Good afternoon, everybody. I want to welcome you to Contra Costa County Board Chambers. I am Supervisor Candace Anderson, Chair of the Contra Costa County Board of Supervisors, and today we have some important information for you, and I'd like to introduce to you Dan Pettycourt, who is our Director of Public Health, Dr. Chris Farnatano, who is our County Health Officer. Today's announcement leaves a lot of family members concerned about loved ones who are living in a care facility, and particularly the impacted care facility. The safest thing we can do for your family members and for you is to encourage you to follow the health officer's order that residents stay in place where they can be cared for and carefully monitored. We continue to express our condolences to any families who have lost loved ones during this COVID-19 crisis. And we're going to continue to urge you to follow the health care orders and to stay in place to maintain the social distancing. This is the only way we are going to be able to continue to battle this insidious virus. After statements by Dan Pettycourt and by Dr. Farnatano, we will be taking questions at that time. And I want to, again, keep a safe distance, wear a mask. We're doing the same today. It's a good way to prevent the spread of this insidious virus. So first, I'm going to turn the time over to Dan Pettycourt, our Public Health Director.
Thank you very much, Supervisor Anderson. On Tuesday, March 31st, Contra Costa Health Services Public Health became aware of multiple reports of a COVID-19 outbreak linked to a 47-bed skilled nursing facility in Orinda. That is a community in central Contra Costa County. To date, 27 persons associated with this facility have tested positive for COVID-19. Our initial investigation revealed 5 cases of COVID-19. 2 of those persons were residents of the facility, and they are hospitalized. We're not aware of their current situation, or their current condition, rather. 3 additional persons are staff of the facility, and they are now on home isolation. Subsequent to our initial investigation, we dispatched a team to do testing at the site for all residents and staff who were there at the facility. To date, those have revealed 22 additional residents that have tested positive for COVID-19, bringing the number to 27. In addition, we are investigating several other reports of positive COVID-19 cases associated with other sensitive occupations and setting, and let me describe briefly what we mean by that. A sensitive setting would be a place like a nursing home, congregate care facility, assisted living facility. A sensitive occupation would be someone like a healthcare worker or a first responder. In these kinds of situations, our immediate task is to work with the facility in an attempt to decrease the risk of continued transmission of the virus. To that end, the Orinda facility has asked us for technical assistance, and we are very much in support of our guidance in terms of managing this outbreak and reducing the risk of ongoing transmission. I would now like to turn it over to Dr. Chris Farnatano, who will talk a little bit about the specifics of what we're doing in this situation. Thank you.
Thank you, Dan. So in this facility, residents who are positive will be isolated and separated from the residents who have tested negative and are asymptomatic. We have advised that the staff do not intermingle between these 2 groups, rather that dedicated staff are assigned to work with one group only. If other staff do test positive, they may be placed on home isolation. We have availed our testing services of the Public Health Department to that staff to aid in that regard, and we'll continue to offer our testing to any staff that becomes symptomatic in the coming days. It's really important that we monitor the staff who have worked at this facility in the last 14 days, which is the full incubation period for COVID-19. In order to preserve staffing, which is one of the most critical resources in these type of situations, our healthcare workforce, we've advised the facility that asymptomatic staff members who have tested positive may continue to provide care to those residents who have also tested positive, providing they wear the appropriate personal protective equipment at all times and not intermingle with residents or other staff who are caring for the residents who have tested negative on the other part of the facility. In this type of situation, our immediate task is to work closely with the facility, which we are doing, in an attempt to decrease the risk of continued transmission of this virus to other staff, other residents, or outside the facility. To that end, we are going to continue to conduct ongoing testing for residents to identify potential new cases. We have directed the staff at the facility to wear masks and other appropriate protective equipment at all times when working directly with the residents. Additionally, we are providing training on the proper use of this personal protective equipment in this kind of situation to the staff. In anticipation of the need for additional protective equipment, masks and so forth at this facility, we've made a request to the County Emergency Operations Center for masks and equipment, and we've already delivered a large supply of that equipment yesterday, and will continue to support the ongoing needs of this facility for PPE or personal protective equipment. We've re-emphasized with the staff the importance of social distancing, hand washing, and respiratory hygiene, and for staff to very closely monitor all the residents for the earliest symptoms, and also to monitor themselves for any kind of early symptoms of illness and stay home at the first sign of illness. We've previously directed all skilled nursing and assisted living facilities throughout the county to stop all group interactions of residents, such as group meals or social activities, and that's been going on for several weeks, and to not allow visitors to frequent the facility except in extreme circumstances, and that's also been a recommendation in place for several weeks. The important thing about this is COVID-19 is a disease with no proven medication treatment and no vaccine. Our primary weapons against this pandemic virus are isolation and quarantine of known cases and their close contacts, and for everyone else in the community to strictly follow these stay-at-home and social distancing directives. This is why I, on Tuesday, along with other Bay Area health officers, extended the stay-at-home order until at least May 3rd and added stricter requirements on who must stay at home and what must be done to social distance. Today, I'm also issuing a strong recommendation for the general public to cover their face with a cloth mask, bandana, or other cloth material when they do have to go out of their homes to leave for essential grocery shopping or going to work in an essential business and are near others. This is in addition, not to replace, but in addition to all the other social distancing measures that we have in place, such as the hand washing and the staying 6 feet away and not going out in public when you're sick and all those other things. And this is due to our evolving understanding of the virus, which now suggests that covering your face in public, in addition to these other measures, can help reduce the spread. This is how we as a community can protect our most vulnerable in our community by slowing the spread of COVID-19. So remember, for everyone, we need to stay in place, maintain your space, stay 6 feet apart, and cover your face. Thank you. And I think at this time we'll take questions. Yes. So my name is Dr. Chris Farnitano. That's ChrisFarnitano, A-N-O, and I'm the health officer for Contra Costa County. In response to your question, so the facility in question is known as the Orinda Care Orinda Care Center. It's a skilled nursing facility. We are not going to disclose names of or locations of other facilities because these investigations are at the very early preliminary stages. But so we're only going to discuss the name of one facility at this time. Do you need the names of?
And I'm Candace Anderson, C-A-N-D-A-C-E, Anderson, A-N-D-E-R-S-E-N, Chair of the Contra Costa County Board of Supervisors.
And my name is Dan Pettycord, D-A-N-P-E-D-D-Y-C-O-R-D.
We were notified on Tuesday that a couple of residents had been sent to the hospital and had developed symptoms. I don't have the precise date when the symptoms started, but we were notified Tuesday and began the investigation at that point.
Doctor, you mentioned 27 hospitalized. Can you go back one more time? How many of those are residents, and also how many have been hot or are still being hospitalized? And how many are live there? How many people are at that facility?
It is a 47-bed facility, but the actual count of residents is a little bit below that. I'm not sure every single bed is full. I don't have the exact count, but it's close to 47, but not a little below. We have 27 individuals. 3 of them are staff, and 24 of them are residents. Oh, we also, at this point, we have 14 negative tests on residents and staff, and we have a few more tests that are still being run today. Well, the tests in individuals that are symptomatic are often, there's a high accuracy and positive rate in individuals who are actually symptomatic with COVID-19. In individuals who are asymptomatic or maybe pre-symptomatic, they may often test negative at that point, and then in subsequent days might test positive. That's why we are going to be following these individuals, and the staff's going to be monitoring these individuals, and we're ready to retest individuals again if they start showing symptoms. None of those 14 are hospitalized. So we had 2 residents that were hospitalized initially. I'm not aware of any others who have been sent to a hospital at this point.
And what are the ages of those affected by this currently testing positive at that facility? Do we have a range like 57 to 100? Just guessing. Do we have an age?
Well, like many skilled nursing facilities, this is generally an elderly population. Most of the residents are over 65, and almost half of the cases are over 80 years old. And we know that with COVID-19, the mortality and the seriousness of the illness is very much related to age as well as other illnesses. So that's why we have a lot of concern about this population.
Elaborate on that. I mean, when you say half of those affected are over 80, I mean,
Almost half. Not.
that is a scary thought for a lot of folks watching. I mean, it is, and I don't mean to be insensitive, but a lot of folks have been saying that this is a death trap or death sentence for seniors over a certain age, and it's scary to think that good enough these folks are over a certain age. I mean, how worried are you? Can you elaborate a little bit about that?
We are very concerned, and again, this is a virus without a vaccine. It's a virus without medication treatment. I think doctors are learning more and more about the best ways to support people through this, but it's still a very, very serious and very deadly virus. So we're very concerned. All the residents have been tested, and we're working to get all the staff tested as well. So the residents that have tested negative, we are separating them from the ones that have tested positive within the facility. This is their home, and they have the staff there that can care for them. So we are keeping them in the facility, having them remain there where they can be monitored and cared for and kept a close eye on. I can't answer that at this time. They were initially asked to isolate at home, but we are providing the option in order to maintain adequate staffing if there are any staff that do test positive but remain healthy, that they could continue coming back to work as long as they follow strict guidelines to only work with the positive test residents.
And I wonder, is that just basically out of desperation because of the staffing shortage? I'm assuming normally you guys would not go that route, folks who are asymptomatic going back to treat those who are positive.
Well, it's probably a practice that may become more common as more cases occur, because we are very concerned about our healthcare workforce. And we know that if someone already tests positive, if they are working with positive patients, they're not themselves at any additional risk of acquiring an infection. We also know that those residents, since they've already tested positive, are not at risk from that staff worker. So as long as we can keep them together, neither the staff or the residents are placed at any additional risk. Well, like I say, there's more than one that our investigation teams are working with now, again, to just follow up on reports and confirm reports and do their investigations. There's a few single patient rooms. Most of the rooms have two residents to a room, and so you're being grouped together with your roommates who both test positive in one area, and in the other area you've got roommates who both test negative together in the same room on the other side.
Go back to basic. Is there enough staffing at this point, even with having the asymptomatic staff back working? Do you guys believe that there's enough staffing to handle the situation?
We do believe there's enough staffing this time, and we're working cooperatively with the facility to help make sure they are able to continue to maintain proper staffing levels. Unfortunately, this does not come as a surprise. This is something we've been worried about and preparing for quite some time. It's the reason why we put in strict rules about visitation in nursing homes and other congregate living facilities, and that's recommendations that also come at the state level and from the CDC and other national guidelines. So we know that this is a very vulnerable population, and so we've really been putting in strict recommendations and guidelines about how to reduce the risk of an outbreak. However, we were always aware that those steps were not a guarantee against an outbreak, and so we've been preparing for this unfortunate situation for some time. We also know that with the rising number of cases throughout the county, that we are seeing this virus in every community throughout the county, and so we know that it's out there in the community, and everything we can do to try to limit the spread is really important.
Policy for visitors, what that policy was before Tuesday and what the policy is now that there's an outbreak? I mean, were they limiting people from coming in before the outbreak or before Tuesday's case?
Yes, the nursing homes were required to stop all family visitation and other stranger visitation, except for a few exceptions. One exception being if someone's near the end of life, to allow visitors that are screened and monitored and aren't showing signs of illness to be able to come. But with those few exceptions, visitors have not been allowed at most of these facilities. Yeah, I'm aware of 2 that were sent to local hospitals. Most are still remaining at the facility.
There's a national debate about whether it's safer to bring your mom or dad home away from these skilled nursing facilities or pure nursing facilities. This is open to any 3 of you guys. What do you guys recommend folks do? Is it safer for me to bring my parents home, or is it safer for them to stay at their current facility?
Well, certainly once there's already cases at a facility and residents are potentially already exposed, we really want the residents to stay there because they can get the care they need, the monitoring they need, and if they're brought home, they could potentially spread the virus to their family members, and if the family members were the ones planning on caring for them at home, and those family members get sick, then the family members may not be able to do that. So we definitely want, in this situation, the residents to remain there where we can closely monitor them, isolate them, and care for them. And so, so that's certainly the recommendation at that in this facility. In general, families bring family members to these type of facilities because they are skilled nursing facilities and they provide a level of care that most families just cannot provide. So they and that's the important purpose of these facilities. So most families aren't able to bring their family members home and provide that intensive level of 24-hour nursing care that these facilities provide. Again, I think that's a very personal judgment, for families about whether, they're better cared for in a family home or better cared for in one of these assisted living facilities. Each family has their own, judgments about where's the best care that can be provided. We have outbreaks in homes as well as these facilities, so that's not necessarily a guarantee against an infection happening. So I think it's an individual case that each family has to make. Oh, yes. I'll try to do that.
Well, Chris, you might want to add, if someone does bring home a family member from living up here, I was just going to add that if someone were to bring home a family member from a congregate living situation, you'd really want to isolate that family member for 2 weeks to ensure that they aren't exhibiting any symptoms, whether it just be in their room, you're bringing them food, things like that. But that's the concern when any of us move our current living arrangements. And so that's why we're doing such a push for try not to change where you're living, mixing up your roommates, mixing up family household members. We really want to cut it down, the insidious spread of this disease.
You know, I'd like to add something else to that, and I'd like to borrow an adage from Paul Leung, who is our communicable disease chief. He's said many times, viruses don't have wings and they don't have legs. And if we move patients who are positive from facility to facility, home to home, we give them legs. So our goal here is to really isolate in place that is very consistent with our Bay Area Health Officer and our state health officer directives. So that's, you know, why we continue to come back to answering this question over and over again the same way, which is it's really our preference that they stay in place and isolate there.
I think that's the presumption that they're positive. I think everybody was asking in general, and facilities haven't been touched yet.
Even in facilities that haven't had a diagnosed case, again, I think Supervisor Anderson and Mr. Petticourt's points are very well taken. The whole point of the stay-at-home order is for people to stay in their own home and not be mixing between homes. So these facilities are the homes for these individuals, and we bring them out of that home and bring them into another home. You know, we create an opportunity for that virus to have legs that may be not yet diagnosed and spread from one family unit, one household unit to another.
I was just in San Francisco yesterday testing medical staff. So there were some pretty high guidelines as far as you had to be exposed for 15 minutes to somebody that is positive, and if you have a mask, that does not qualify you to get a test. What are the parameters for these healthcare workers to get a test? Can you speak to that?
So the CDC has very extensive guidelines that break down risks, categories of risk for exposures for healthcare workers, and a lot of it has to do with the type of procedure they might have been doing. Were they doing some invasive procedure that's exposing the healthcare worker to body fluids? Were they very in close proximity to that person? Was that person a known positive or just a suspect? How long were they spending with that person? What type of personal protective equipment were they wearing? Were they wearing a surgical mask like I'm wearing? Were they wearing one of these N95 masks? Were they wearing a face shield? So it's a very detailed risk assessment based on that. As a general principle, in the most part, we're not recommending testing of asymptomatic individuals. And the reason for that is the result of the test doesn't give you that much information if it's negative. Because if someone has been exposed, they may be incubating the virus, but their test may be negative. It doesn't mean that tomorrow their test's not going to turn positive or the next day. Now, in this case, because of the high risk of this population, and also the fact that the very elderly often don't show the most typical symptoms. They often don't develop a fever or develop a fever as high, and some of them have dementia and aren't able to report their symptoms. And so because in this type of a situation, we really felt it was important to test all of the residents, including the asymptomatic ones. But we will continue, the ones that test, and the staff as well. All the staff is in the process of being tested. Our plan is to complete. Mm-hmm. It's being in a facility with these types of patients who are at such high risk and may not display the typical symptoms. We're really, our public health team is really evaluating these situations on a case-by-case basis.
So I just want to follow up. You mentioned staff is being tested at this point. We have 24 patients positive, 14 negative. Are there any more patients, residents, the senior residents, are there any more senior residents that are still awaiting results at this point? Because 24 plus 14, that's 38. I know you mentioned the 47 beds, not all of them are taken up. So I just want to get the numbers.
We have a few outstanding tests. Hopefully we'll have the results later today. I don't have the exact count on those outstanding tests, however.
Give us the conditions of these 24 senior residents right now. You mentioned 2 hospital lots. give us grave condition, fair condition, good condition. Can you elaborate more on the condition?
I don't have any information about the hospitalized patients. The ones in the facility, some have symptoms and some do not, but none of them are symptoms that are severe enough to warrant being sent to a hospital. If they do develop that level of symptoms, they would be sent to a hospital.
Just your thoughts overall, and we take a hit, we might be okay for these seniors, totally different ballgame. Just want to get reaction, emotions. How do you feel about this?
I think we're all very concerned. We're all worried, and we're especially worried about our seniors and our elderly and those have severe chronic illnesses. But young people too, and we've seen cases young people dying of this virus, people, middle-aged individuals dying of this virus. So in general, it's less severe for younger people, but that doesn't mean there's no risk at all for younger people. So it's something we're all concerned about, but especially because of the dramatic difference in the mortality rates with age, we're especially worried about the elderly. Thank you.